Tracheostomy tube placement is a commonly performed procedure. Its utilization permits ventilation in patients with compromised airways as well as in patients who need mechanical ventilation. Despite its frequent use, the tracheostomy procedure and the tracheostomy tube are not free of complications. One such complication is subcutaneous emphysema. Subcutaneous emphysema is a rare condition in which air becomes trapped under the skin. Specifically, the air is trapped in the innermost of the skin's 3 layers, known as the subcutaneous layer. This is most likely to occur in the chest, neck, and face, but it can happen in any part of the body. Subcutaneous emphysema can be caused by a variety of reasons. For this video, I will focus on subcutaneous emphysema, which is caused by the tracheostomy procedure and tracheostomy tubes. Subcutaneous emphysema is unlike the other form of emphysema, which is a type of chronic obstructive pulmonary disease, or COPD, which is often caused by smoking. Subcutaneous emphysema is also commonly referred to as crepitus, subcutaneous air, surgical emphysema, tissue emphysema. Although subcutaneous emphysema can be caused by many different things, when associated with a tracheostomy tube, the following may be causes. When undergoing a tracheostomy tube placement, there is a very slight risk the posterior wall of the trachea may be cut during the surgery. This allows for air to enter the subcutaneous layer of the tracheal wall and can lead to subcutaneous emphysema. Fenestrated tracheostomy tubes have one hole or multiple holes in the shaft of the tracheostomy tube. The tracheostomy tube can move and the holes can be positioned inside the tracheostomy site. In patients with a newly created tracheostomy, the fenestrations in the tracheostomy tube can leak air into the subcutaneous tissue and cause subcutaneous emphysema. After a tracheostomy tube has been placed, a rare complication which may occur is subcutaneous emphysema. This happens when the tracheostomy tube is pulled too tight. The tracheostomy tube rubs against and punctures the tracheal wall. This can lead to air leaking into the subcutaneous layer and may cause subcutaneous emphysema. Symptoms of subcutaneous emphysema can range from mild to severe. More severe cases can lead to significant discomfort and serious complications. However, it is also possible to not have any symptoms at all. Symptoms vary depending from person to person, but in general, they will include edema around the neck, chest pain, and crepitus. This is a crackling sound made when the surface of the skin is examined by touch. Crepitus is often the symptom which leads to a diagnosis of subcutaneous emphysema. Other symptoms of subcutaneous emphysema may include sore throat, neck pain, difficulty breathing, difficulty swallowing, and speaking or voice changes. Severe cases of subcutaneous emphysema can lead to serious, although rare complications such as respiratory failure, problems with the airway, tension pneumothorax, which is also called a collapsed lung, skin necrosis, which is death of skin tissues, and compartment syndrome. This is swelling of muscles and other body tissues. If subcutaneous emphysema is suspected, the following tests may be ordered: X-rays, CT scan, laryngoscopy or bronchoscopy, and ultrasound. Subcutaneous emphysema usually resolves in about 10 days without serious complications if the underlying cause is successfully treated. During this period, the air pocket is gradually reabsorbed into the body. Symptoms can be managed with oxygen and pain medication. Treatments for subcutaneous emphysema may include the administration of highly concentrated oxygen, since it helps the body absorb the subcutaneous air more quickly. The insertion of a chest tube may also be necessary to remove the air. In some cases, small incisions may be made, or needles or catheters may be used to get rid of the excess air. Severe cases of subcutaneous emphysema may require surgical intervention. When getting a tracheostomy tube, carefully monitor the patient for any complications such as neck pain, chest pain, swelling, and difficulty breathing. If subcutaneous emphysema occurs, it will require immediate medical intervention. Delays to treatment could be fatal. When getting a tracheostomy tube, make sure the tracheostomy tube used after surgery is not a fenestrated tracheostomy tube. This complication can be avoided by simply asking the physician to not use a fenestrated tracheostomy tube. A fenestrated tracheostomy tube should not be used until the tracheostomy site has completely healed. For guidance on this, please talk to your medical provider. When using a tracheostomy tube, do not pull the tracheostomy tube tight. Always make sure you can fit 2 fingers between the tracheostomy tube tie and the neck. For children, make sure you can fit 1 finger between the tracheostomy tube tie and the neck. For more details about how tight the tracheostomy tube should be, please talk to your medical provider or respiratory therapist. If subcutaneous emphysema is suspected in a patient with a fully healed tracheostomy site, loosen the tracheostomy tube ties and seek medical advice. Generally, subcutaneous emphysema is self-limiting in this situation and will resolve on its own once the tracheostomy tube sits properly in the airway. Thank you so much for joining me. Please remember to like and subscribe down below. I hope you have a great day and a wonderful week. Bye-bye!